Hey, sister, I'm going to get right into it today. Have you ever found yourself starting a workout maybe and suddenly you realize you're leaking pee, or jumping on the trampoline with your child, or maybe you're waking up so many times in the night to pee, or maybe you're just urinating when you're not expecting it. And sometimes the world is like telling you, hey, this is normal, or you're too embarrassed to do anything about it. There was a lot of years when I would avoid doing things like jumping jacks or high knees because in my workouts, because every time I did them, I would pee myself. And I remember making a post about it and thinking it was like trying to find humor in it. And one of my nearest and dearest friends gently reminded me that that's not normal and we shouldn't normalize that behavior. And that was the beginning of me learning so much around this piece. And the longer I help women, the more hundreds of women I've been able to help in perimenopause, the more I've become to understand that peeing in perimenopause is a common thing, and yet it's not normal. So I'm really excited to have an expert on today, and my dear friend who is an orthopedic and pelvic health physiotherapist and yoga teacher who actually combines these two practices to help women find the most optimal function of their pelvic floor and core. And she's here today to talk to us specifically about peeing in perimenopause and maybe a few other things. So I'm really excited to get right into the reality of this conversation. Welcome, my dear friend, Leslie Richards. Welcome, Leslie.
Hi, how are you?
I'm good. I'm so glad you're here today.
Oh, thank you for having me.
Yes, me too. So tell us just a little first, tell everyone listening how you came, because that's unique, I think, the combination of physiotherapy and yoga and specializing in that pelvic floor area. How did you come to merge those two, or want to merge those two?
Well, I started off working as a physio, and after a year or two of my physio practice, I started doing yoga as well. And this is not uncommon, but it's kind of unfortunate. After starting to do yoga, I noticed I was having more pain, more neck pain, and more shoulder pain, and more SI pain, and yeah, I thought, wait a second, why am I leaving class and I'm in more pain? So it started really um, letting me explore my posture, explore the way I moved. I continued on with my yoga practice, but I really took a big step back and kind of brought my physio brain into the mix as well, and noticed areas that I was really compensating when I was working kind of harder than what I should have been, what I was actually strong enough to do. I was doing a lot of arm balances, a lot of, chaturangas and planks, and shrugging my shoulder right up to my ear because I wasn't actually strong enough to maintain that nice open
Oh,
chest. And so when I started investigating and kind of bringing my anatomy and biomechanics and the training that I got in my physio into my yoga practice and combining them, I started feeling better. And I took a big step back in my yoga practice. I started doing all of my planks on knees, and maybe I only did one or two chaturanga rather than, going the full flow of the class. And then eventually I was able to do those pain free. And then I started to build on. So again, kind of approaching my yoga practice like a physio treatment
yeah.
or treatment plan. Yeah, and then I thought, if I was able to do this myself, let's start doing this with my patients. And then I got my did my yoga teacher training and got my certification so I could start using this in my physio practice, but also doing yoga classes and bringing that function and that whole concept into the yoga world as well.
Like
And now
merging both in both worlds.
yeah, I did. I've done over the years a therapeutic yoga class where I keep the class to kind of a smaller number. We use a lot of props, we use chairs, we use the walls, we just make it more accessible to all bodies and kind of make the practice work for the bodies, because everybody is so different and we all come with our histories and our, you know, injuries and activities and jobs and all this stuff that imprints on our bodies.
Mm.
So yeah.
I feel like we could do an entire episode on that specifically, on how like we maybe push through and don't even hear what our body is saying to us,
Yes, which
because
is,
we're just trying to get to that end result or
yeah,
something and not, yeah.
which is so, kind of coming back to pelvic health, or coming around to pelvic health, I suppose. So much of our pelvic floor dysfunction and, pelvic health is associated with kind of not paying attention at all. We ignore what's going on down there. We've never really noticed what's going on down there. We've had lots of stuff happen there. And so we've kind of lost this connection.
Yeah.
And so yoga is a really wonderful way to bring that mindfulness and that awareness back into the mix.
That's interesting. So I feel like most women know, what their pelvic floor is, or they've heard about it. But can you, like, why don't you just tell us, what is our pelvic floor? Where is it in our body, and why does it matter?
Yes. So our pelvic floor, it's a group of muscles that sit at the very base of the pelvis. So if you were to have a pelvis in front of you, and you can even feel on your body if you'd like, but we've got our pubic bone up front,
Mm-hmm.
we've got our tailbone at the back, and then we've got our sits bones, or ischial tuberosities, which are those bony bits in your bum that you can
I'm
feel on
feeling
the
them.
chair. And so that's your pelvic outlet. That's where our poop and our pee and our babies and, if things are inserted, that's the opening there. And
Thanks.
and we have this group of muscles that basically fill in that opening.
Yeah.
And then we have the openings within that, our urethra where we pee, our vagina, and our anus.
Okay.
And so the pelvic floor muscles, their primary functions are going to be to maintain the closure, so our continence of our urine, our feces, to relax and allow our pee and our poop to come out, to allow ourselves to have a baby, to allow penetration. We have these muscles that, I don't know, we want them to be able to do both. We want them to be able to close and maintain closure. We want them to be able to relax and open up. And then they support, it's kind of like a hammock that supports our pelvic organs. So our bladder, our uterus, fallopian tubes, our rectum, and bowels. So
Kind of important.
there as well. With our pelvic floor really affects our sexual function and pleasure with sex, the ability sometimes to have sex and orgasm, and
Oh boy, and there's another episode right there to talk about, is like pain, during these years. But okay, so we understand that, especially with regards to peeing in perimenopause, which is what we're trying to stay focused on today, because there's so many juicy topics. We understand that the pelvic floor is really important in like the allowing and relaxing of like a full urination, and also like the closing and supporting of, so we're not having incontinence or peeing our pants. So in perimenopause, when we know, obviously, like perimenopause, as we know, is that sort of that shifting of time, or that reverse puberty time in our hormones. Is it more common for us to start having issues with our pelvic floor during this time?
It is, yes, yeah. Particular estrogen in particular has an effect on the elasticity, or the kind of tensibility of the tissue. And so as we go through perimenopause and menopause, and our estrogen fluctuates as much as it does, that's going to affect just the tissue in general. And that, it can create a little bit more laxity, a little bit more weakness within the pelvic floor. So that right there is going to play a role.
Okay. And is it the fluctuation of the estrogen, or is it the lessening
the
of
lessening?
decline?
Yes.
Okay.
More the lessening as the estrogen decreases. And that's something that will be used to assist with pelvic floor function, is, an estrogen topical cream or estrogen suppository that just helps the tissue. So that is an option that is used sometimes.
Okay.
So, and can be really, really effective.
Oh, ew, that's interesting. Okay. So one of the reasons that it gets harder is because of the actual fluctuation of the hormones.
And that decreasing estrogen. Yes. Yeah.
And anything else? Is there any other reason that leakage or incontinence or peeing? Like, and I have had clients, I've had several clients talk about, at night it happening without even recognizing that it's happening. Like it's a real thing.
Yes. Yeah. Well, there are things that, you hate to say it, but it's unfortunately true. As we age, things happen. Our body, just kind of like anything, it can wear out a little bit.
Yeah.
So our bladder, we can lose that extensibility or the compliance of the tissue.
Yeah.
So it might not be able to hold as much.
Mm-hmm.
Sensation can decrease a little bit. So we lose that perception, that feeling that we need to go.
Right. Okay.
Contractibility. So we don't completely empty, and we have kind of bladder urine that's remaining in the bladder. Losing a bit of the pressure of the closing pressure of your urethra. So just
Okay.
a little bit of kind of laxity in tissue. Decreasing strength overall, and the speed of contraction of pelvic floor muscles. And this was crazy. I actually just heard this stat. Between the ages of 40 and 80 years old, we naturally lose 30 to 50% of our muscle mass. And that's in our body in general, but our pelvic floor is part of that.
Right.
So this idea of kind of maintaining a strength program, a rehab program,
Yeah.
just like we do for the rest of our body. Just as prevention of all of those things that unfortunately come along with age.
Yeah.
And then there's things on top of that, kind of outside of the pelvic floor. We generally have a higher body weight, and particularly around our abdomen, which can put more pressure on our bladder and our pelvic floor muscles. Constipation tends to go up as we go through, and that chronic straining can put a strain on the pelvic floor. Not like fully emptying bowels can put pressure on our bladder and make it harder to empty and to fill. Pelvic surgeries, so hysterectomy, slings, any surgery through the area is naturally going to make the tissue a little bit more lax and have an effect on the pelvic floor.
So that includes cesarean sections?
That includes, yeah. Diabetes, neuropathies, we often think about to the extremities, but that can also happen to pelvic floor.
Right.
So there's lots of things. And mobility, just in general, as we get older, we often lose our mobility unless we really try to maintain it. So you're not going to get to the toilet as quickly.
Right.
Yeah. So
It's
there's
so
lots of things that
yeah.
seem to come
It's
come
so
up.
interesting to hear all of the things, because you follow the bouncing ball back on some of those things, right? You talk about like constipation obviously being part of an issue, and I know like food sensitivities or like certainly inflammatory foods can really play a role in constipation, and also in in urgency and feelings in the body, like just overall irritations. So there's a lot of pieces that we do get to control, I guess, and then some that, as you're saying, is because of the fluctuation of the hormones or the declining of the estrogen, and some is we'll call it wear and tear.
Just that natural aging that kind of comes with the body.
But can we just kind of, if I were to say to you, hey Leslie, I'm leaking in the middle of the night, but this is just normal, right? Like I'm just getting older. This is just what do you say to that when we talk about it being normal?
Well, I said no, that's not normal. It's common. It happens a lot, but it's not normal. There are definitely things that we can do to change that, whether to eliminate optimally, to decrease for sure. But we get into these situations kind of because we don't pay a lot. We just kind of let it happen. And then as soon as we start paying attention, as soon as we start putting some focus and attention, you start to see the changes. As long as you're
like
consistent,
anything,
as long as you're persistent, as long as you do it, you see the changes, like any type of rehab or training program. You can really make changes which is wonderful.
Yeah, because, peeing yourself, like, or limiting your life because you don't feel comfortable doing something, or you're afraid that something is
Yeah.
going to happen, like you're going to leak or you're going to pee, or, like, I often, I want to get on the trampoline with my kids. And there was a time when I absolutely couldn't. And that was like
Yeah.
a real bummer in life, or just doing certain workout programs that I liked, or, if you're just overall like worried or about being
Yeah.
somewhere or sleeping over somewhere or doing something, it starts to really limit your life that way. But
It
I love
does.
I love how you explained it. It's like we almost want to think about them as that the grouping of muscles that they are, as an opportunity for us to strengthen those, just like, or treat them just like we would a regular strength training program, with both
Yes.
strengthening and releasing and
Yeah,
that.
just getting that most optimal function of the muscle and yeah.
With so okay, so I like that you said that it's common. So like leakage, nighttime peeing, frequency of having to go all the time. These are all common things. What else is common but not normal?
So the big ones with bladder are going to be, you've mentioned, so our stress or urge incontinence. So that's leakage. Our stress is when I cough, I sneeze, I laugh, I go on the
Mm,
trampoline, an extra additional stress is kind of put down through the bladder,
okay.
or your intra-abdominal pressure is increased from the diaphragm dropping down that pressure, and we can't
Hmm.
maintain the closure. Or urge incontinence, which tends to come a little bit more towards perimenopause, menopause.
Okay.
Like oftentimes the stress incontinence is a little bit more, after I've had a baby, earlier on. And then as you approach menopause and go through perimenopause, you might start to get this urge incontinence where I have a strong urge, I can't quite make it to the toilet, and I have a leak on the way.
Yeah.
And when you've got both of those, that is considered mixed incontinence, where you have a bit
Mhm.
of stress, a bit of urge. But like you said, frequency, having to go to the washroom, about 8 times a day is considered, quote unquote, normal.
Oh, interesting. 8 times
So
a
if
day.
you're going more than 8 times a day, then you are kind of getting into that frequency.
Okay.
Urgency, maybe you don't leak on the way to the toilet, but you're, all of a sudden it's like, I gotta go now.
Yeah.
There's no holding this,
Yeah.
and you do a beeline to the toilet. But you can get, pain with your bladder filling that can be relieved, when you have your pee. You can get, oh, I'm putting on the spot here. What
No.
is incomplete emptying?
Okay.
So you go not that long later, you feel like you have to go again, and usually that leads into that frequency if you're not getting a complete emptying.
What if you sit down and you pee and you're just caught up, scrolling your phone like some people do, and you think you're
Yes.
done, but then all of a sudden you have to pee more like 30 seconds later?
Yeah.
Is that an issue with the inability? Asking for a
Yes.
friend.
Yeah. Yeah, definitely. And that hesitation of I sit down and I want to start going, and I
Pee
can't get it
phobia.
starting. It started. So that sometimes those are often more if there's tension and tightness in your pelvic
My
floor and you have
God.
that hard time kind of relaxing and letting it open.
I thought that was just a stage fright thing. I didn't know that was an actual. Look, we're learning so much about what's
I
normal and what's
know.
not normal, but common.
Yeah. And when we talk about all these bladder symptoms, um, they relate to our bowels as well. We talk more about bladder and urinary incontinence because as much as it's something that we don't like to talk about much, it's easier to talk about than our bowels
Right.
and having incontinence of stool or feces.
Yeah.
But that is something that happens on a regular basis as well when we have pelvic floor, dysfunction of some sort. Yeah, so we can have and pain with bowel movements, constipation. These are all bowel symptoms that are connected with our pelvic floor. So symptoms that if you experience, yeah, it's a good sign that there is something going on with the pelvic
Yeah.
floor. Yeah.
I love that you shared that, because I think, we always talk about it. It's like a lot of the times I think women suffer in silence because we're embarrassed, or we don't realize that something isn't, we think maybe it's normal, or we pretend it's normal. We're embarrassed. So I think even just having this conversation, talking about, the fact that, I think to kind of summarize what I'm hearing you say is that these are common symptoms like leakage, frequency, inability to empty, and even some fecal issues that way,
Yes.
even though that seems more embarrassing, are common but not normal. And they are a result of pelvic floor issues more often than not, which means
Yes.
we can improve them. And they
Yes.
get worse in perimenopause, one, because of hormones, and two, just because of relaxation and wear and tear and past trauma.
Yeah.
Okay.
I just pulled up here just a screening for pelvic floor dysfunction. So it's a few questions that is a good indicator of, if I've ticked off these, that's a good. So do I urinate more than 8 times per day?
Okay. Oh, this is good. Okay. So for everyone listening, these are the questions you can ask yourself to know whether you're maybe struggling in this area. So sorry, what
Yeah.
was the first one?
So do you urinate more than 8 times per day?
Okay.
Do you have difficulty initiating your urine stream or experiencing burning with urination?
Okay.
Do you experience very strong or very uncontrollable urges to go to the bathroom? Do you experience any fecal or urine leakage on the way to the bathroom, coughing, laughing, sneezing, exercising? Do you have pain during or after a bowel movement? Do you struggle with having regular bowel movements? Do you ever experience painful intercourse? Do you experience pelvic pain or pelvic pressure in your vagina, rectum, penis, testicles, bladder, tailbone, or pelvic girdle? And then for men, do you experience any penile, testicular, or prostate pain? And for women only, do you experience pain or cramping with menstruation that requires intervention? So heat, medication, rest. That's it.
Interesting. So our PMS symptoms, or what we slough off as like, oh, I'm just, I have my period, could in fact be correlated to pelvic floor issues.
Mm-hmm.
Wow. Okay. So we understand what, the normalcy and not normalcy here is, and how to know if you fall into that category or not. What can we do? Are there things we can do on our own, Leslie, or do we, yeah, what are there things we can do on our own to start strengthening this, like as a practice, whether we need to go get help or not?
Yes. Yeah. Well, I think one, education is a huge, huge component. There are so many things that you can just do a little bit of research. The place where I got my training, Pelvic Health Solutions, has a wonderful website that has a ton of information for someone just coming to investigate. There's a heading for patients. You can click on that and it pulls up a huge menu of just general information about the pelvic floor, about what pelvic health physio is.
And is it like interesting, or do you need to be someone who wants to geek out on that to like it?
It is, well, it's something that if I'm dealing with urinary incontinence and I want to do something about it,
You would be interested.
I want to take the time to invest in learning a bit about what's going on.
Right.
And so it's a great resource for
Okay.
understanding a little bit more about what's happening, and that it's normal, and that this is,
Yeah.
there's a name for this, or there is, and it gives some good understanding as to why it's happening, some things that can be done, as well as discussing just kind of how effective pelvic health physio can be. It
Yeah.
is kind of becoming the go-to for incontinence, urinary and fecal incontinence, pelvic
Mhm.
organ prolapse, pelvic pain. It's a very effective way. And so it's a good resource just to learn a little more. Podcasts are wonderful. There are so many podcasts out there that are talking about the pelvic floor and giving a little bit more information and understanding to it. I run, if you're in the Belleville, Ontario area, I run a yoga for pelvic health class. And in Coburg here at East Studio, I do some workshops, as well as at We Thrive Wellness, where I work in Belleville. And I do workshops and do this yoga for pelvic health class to give more understanding and information, so people just can learn a little bit
Yeah.
more.
Okay, so step one is definitely learn. We'll put that, by the way,
Yeah.
we'll put the Pelvic Health Solutions link in the show notes. And maybe
Yes,
if Leslie wants to share a couple of her favorite podcasts, I'll throw those in there too, so everyone can see
yeah,
and check out, look in your area. I mean, if you're not, obviously not, people listen from all over the world. So look in your area for a yoga for pelvic health. Like
yes.
maybe you're saying, you did say it's starting to become more popular.
It definitely is. I imagine if you investigate kind of whether it's pelvic health in the area, or yoga for pelvic health, or exercise for pelvic health,
Okay.
it's definitely becoming something that is um, becoming more mainstream and available. YouTube is wonderful. Like,
Okay.
you can take a look on YouTube. There are so many yoga, Pilates type classes that are based, and exercise classes that are based around pelvic health. So there's
Okay.
lots of options to
And
investigate.
would you say, less like if we're trying, so let's say, I go to YouTube and I find some like pelvic health things to follow. Is it
Yeah.
similar to like any other muscle group, where really it's something that maybe I want to work 2 or 3 times a week?
If you, depending on where you are. So this is, independently, you can start, and yeah, 2 or 3 times a week. If you find that bringing a bit of pelvic health focused practice a couple times a week is, um, you're not seeing any particular changes or improvements,
Mhm.
that is when I would say going to a pelvic health physio, where you can have an assessment done. We
Mhm.
do physical assessments, external as well as internal is optional. It's something
Mhm.
that is really helpful,
Okay.
because then we get an kind of a complete understanding as to what is happening in your pelvic floor,
Right.
um, to really individualize your program and your rehab to do specifically what your body needs.
Of course.
Um, that's one of the challenges with the pelvic floor, is that it's internal, and
Hmm.
we do tend to have this disconnect. So a lot of the times when people are suffering from pelvic health symptoms or pelvic floor symptoms, they don't really know, am I engaging? Am I not? I'm not quite
Mm.
sure. When I engage, am I also holding my breath and clenching my bum and gripping my toes?
Oh my gosh.
Doing all of
Stop
these other
it.
things. Whereas coming to see the pelvic health physio,
Mm.
we're able to determine what is going on. Does the pelvic floor, you know, need strengthening? Does the pelvic floor need to learn how to relax?
Mm.
Yeah, so there's that guidance, a little bit more specific, if you do go and have or work with a pelvic health physio.
Right.
Yeah,
They
so
can
that is an
focus on
option
that
as well.
stuff.
If you kind of recognize I have some symptoms, you learn a little bit more, maybe you try to do some things on your own through
Research and learning.
and yeah, if there's any classes, and group classes in your area or online. But if you find you're still kind of struggling, booking in and having an assessment, you can always call. I know at We Thrive, I have a 15-minute phone consultation that's free, that is available to just chat and get an idea if it is something that is appropriate, if pelvic health will be beneficial. If you want to book in for an assessment after that, you can. But
Oh,
yeah,
that's amazing. So for anyone who's listening, if you're struggling if you're recognizing yourself in some of these symptoms, and probably you are if you're still listening to this episode. So, and I'll be the first to admit, I'm going to have no shame. Like, this is not like, this has been something I have struggled with. So it really does hold you back in life. It really does get harder in perimenopause, and it really can improve. So so what we can do is what Leslie's saying is if you go out and research a little, you recognize yourself in that, you try some things and it's not working, or you're at the point where you're suffering so much, that's when you know it's a time to reach out. And we'll put a link in the show notes as well so that you can reach out specifically to Leslie if you want and schedule a free 15-minute call to see, if it is the right thing for you to have an assessment. But if we, I think so I understand there's those kinds of things that we can do. Is there a way to self-assess if you are like, if you're clenching or relaxing, or like, is there an easy way to do it at home?
Yeah, one thing so I often know my first visit with women, one of their homework pieces is to go home until I see you again. Just start to notice, if you're driving home and you're engaging those muscles, like you're trying to stop the flow of urine or holding in gas, but you're not, see if you can let them go. Just notice if there is this pattern, this habitual tensing, clenching, engaging. So that's one thing, just start to notice what's happening in that area. And then starting to bring some awareness and maybe trying to engage and find those muscles, trying to relax and see if you have that letting go. You can always put your finger inside your vagina and feel, try to engage and see if you feel kind of a closing around your finger, if you feel a little bit of a lifting so those muscles want to provide that closure and lift.
Okay.
So if you insert finger into vagina and you engage, you want to be feeling for a closure and a lift. If you relax,
when you engage,
yeah. You feel for that kind of letting go and opening around your finger.
Okay.
So
and let's be super descriptive. Are we talking like one knuckle in, like we just need the tip and squeeze
you
into
can, yeah, depending on how comfortable you are in. And this is the thing, are the kind of finding the point. Yeah, I would put the finger in, fairly, maybe up to the second knuckle. Yeah.
2 knuckles in, ladies.
Yeah. So that's a way of kind of testing, stopping your flow of urine.
Ooh.
That's something that you don't want to be doing all the time, but if you every once in a while want to kind of get an idea of when I am contracting my pelvic floor, is it contracting? See if midstream you can stop the flow and then let it start again. Again, not something you want to do all the time because we don't want to start retaining urine and kind of, but if you want to just check in with, what can I do this? Can I slow the flow? Can I stop the flow? Can I relax and let the flow start going again? Or, when I relax, does it take a little bit of time for that flow to start up again? Yeah. So those are some good ways of kind of checking in a little bit with
where you're at.
Yeah.
And then is there anything we can do? Like, let's say we realize at that point that, we can't do those things, or it's not grasping, or maybe we're always clenching on the drive home. Is there anything we can do to work on that? Or is that when we definitely should be coming to see a physio?
Well, that might be when I would start to go down that kind of route of investigating a little bit further. Oftentimes, if you are, so our pelvic floors can kind of tend to go we're more have weakness or underactivity, or we have tension, tightness, restriction.
Right.
Both can create symptoms. If you tend to be more, have more pain, have issues with starting the stream, have issues with constipation, pain with sex penetration, as well as in the incontinence, frequency, urgencies, they tend to be more with a tense or a tight pelvic floor. So if those are symptoms that seem to be more typical, you might really focus on deep breathing, diaphragmatic breathing, belly breathing, trying to find some relaxation and letting go of the pelvic floor. That will be that's when you tend to maybe notice you're always clenching, gripping, bringing in just stress relief, whether it's doing a meditation practice, whether it's going to a yoga class, whether it's going for a walk in nature, having a
Mm.
nap, whatever it is to help manage stress and anxiety, that tends to be more that hypertonic or that tense pelvic floor.
Yeah.
If you, have incontinence, or if you have a pelvic organ prolapse, but if it's more incontinence, but you don't get the other symptoms that come along,
So
that
no
tends to be a little bit
pain.
more of that weakness,
Okay.
and working on, okay, I want to try to build some strength of my pelvic floor muscles. I want to feel that, kind of work on finding that closure and lift, doing the kegels.
I was gonna say, is that when we do the Kegels?
Or,
Only there. We
yeah.
don't want to do the Kegels if you're already too tight.
Well, if you're already tense, then you tend to do more of a reverse Kegel. So we're more of working on that letting go and relaxing. And
Okay.
that's what I'll use the deep breathing, using your big, nice belly breath where your diaphragm drops down and it lengthens out your pelvic floor and encourages more of that letting go. Yeah, so for more of the tension, the tightness, you're going to be working on that reverse Kegel and trying to let go and relax
Yeah.
versus contract and find the closure and the lift.
Ooh, that's amazing. I feel like that really gives a clear like definition for people of like, okay, what could be my issue if I'm in
It
one of those,
helps
and
give
what
a bit
do,
of guidance. Yeah.
yeah, what do I do first? I know our goal here today was to like how to teach you how to stop peeing in perimenopause, peeing your pants, stop peeing your pants, because we want to laugh about it, but we want to, I think the point here, from my experience that I had to learn the hard way is that it is common but not normal. We don't need to normalize it. It is something that absolutely shouldn't hold you back in life. And
Yeah.
Leslie, you've done such an amazing job of, I think, teaching us why it happens further in perimenopause, what the core source is behind it, and how to know even what your issue is and where to go from there. So I feel really excited about what we went over today, and thank you so much. Is there anything else that you feel like we should know about
Um,
this specific part?
One thing that I would say, last thing I'll say with, we didn't really talk much about the frequency, the urgency, and lifestyle changes, things that we can do to help manage this, decrease this, change this a little bit,
Okay.
because as much as our pelvic floor plays a role in it, some lifestyle and behavior changes can make a huge difference in the symptoms.
Okay.
So keeping a bladder diary, and that's something that I'm sure probably if you Googled, you could find a template for it. But as a pelvic health physio, I'll often give this to a patient who comes in who has frequency, urgency, leakage,
Yeah.
where you just get a snapshot. You document kind of every time you go pee, how long those pees are. So we count from beginning of flow to end of flow,
Yeah.
on an hourly basis for 48 hours,
Mm.
what drank, when you've gone poop, when you've leaked. And so
Right.
it takes this snapshot, and then you kind of investigate, recognizing our bladder. Before our bladder is completely full, we get two kind of warning urges or warning signs that the bladder is filling. So when we respond to our bladder kind of every time out of fear that we're going to leak, or we're going to, we get this urge, recognizing, okay, our bladder might not be totally full. And this is where we start to
Ooh,
kind of work with retraining the bladder
right.
and looking at that snapshot. So this is something that, um, learning how to do urge delay strategies. So,
Mhm.
I peed 30 minutes ago. I'm feeling in the urge to go again now. I know that this is my bladder's first warning sign that it's filling up. I don't act, my bladder's only a third of the way full. I don't actually have to go and, empty. And so I'm going to use some of these strategies. So it might be, doing some deep breathing, having a seat down, relaxing, doing something to distract yourself to try to get through that urge.
Right. Almost like you're training your brain, retraining your brain.
Yes.
Because if it got used to being like, oh my gosh, I'm going to have to pee, I have to pee now. And then if you're going on that
Yeah.
first urge, then you're always going to feel like that's the most important
Yeah.
urge.
And if that, that creates more tension, more stress, then we have a leak because those muscles are not working most
Oh,
optimally.
right.
So if we can use some of these strategies, it might be a distraction, physically, you're poking your
Yeah.
fingernail in your hand, or distracting, thinking about like your next vacation, or
Yeah.
just
Yeah,
getting
like you
through
said, deep breathing, like trying to move through a craving. Sometimes we have
Yeah.
these cravings really similar. It's a mental piece of the puzzle
Yeah.
where it's like, okay, I just need to move through whatever is creating this right now
Yeah.
and decide whether it's real or not.
Yes. And then
Mhm.
bladder irritants, taking a look at, things that we ingest,
Mhm.
whether it's food, drink, medication, but they can create a concentrated urine. They can create a kind of irritated bladder.
Mhm.
And so some really common bladder irritants are going to be, caffeine and alcohol,
Mhm.
tobacco and cigarette smoke, and some things that it's like tomato-based products, spicy
Mhm.
foods, chocolate, some of
Chocolate.
these
Poor chocolate.
carbonated beverages,
Yeah.
artificial sweeteners, so things that can really sneak into our everyday life diet.
Yeah.
And sometimes it's a matter of recognizing, what, tomato-based products irritate my bladder. And if I remove them or limit them or drink some extra water to dilute my urine, if I'm going to have some tomato-based products,
Yeah.
then I'm not going to be going to the washroom, 4 times in the
Yeah.
next 3 hours because I've removed that irritant.
Yeah. And
Um,
sometimes I think removing the irritant just gives us at least it like takes the edge off enough and gives the bandwidth enough for you to do the other work,
yes.
to breathe
Yeah.
through that initial urge, I think is what you're
Yeah.
saying to like encourage yourself to make different decisions, to actually do the strengthening and releasing when you're not afraid that this other thing is going to happen because
Yeah.
the
If
irritant
you
is
remove that irritant, you're not going to be getting, the
not
same.
so bad. It like, yeah,
Yeah.
that's what, kind of, and I think that, I mean, that goes for anything, right? I think that goes the same for, again, for our cravings in life. Like if you move the major irritants of your life, then everything gets a little bit easier to handle because you're not being literally irritated or scab being
Yes.
picked. So
Yeah.
yeah,
Yeah.
that's good. Oh, that's
So those
amazing.
are the last couple of things that it's amazing how many um, things just in lifestyle and our behavior that can make a big difference. Nocturious, going pee at night, that is something that a lot of the times we wake up.
Yeah.
Our bladder doesn't particularly need to be emptied, but we're lying there and we think, oh, well, if I don't pee now, then I'm going to have to pee in an hour. So I might as well just get up and go
Yeah.
pee. But if we start to use some of those urge delay strategies at night, okay, I'm going to settle. I always say deep breathing because one, it might get you through the urge. It's going to relax your pelvic floor. It's going to relax your bladder muscle. It's going to nurture your parasympathetic nervous system,
Yeah.
your rest
Which
and
is what we want.
digest, and it might settle you right back to sleep.
Hmm.
And before you know it, it's morning and you didn't get up 3 more times to go pee. So starting to implement the urge delay, and I love the breathing for urge delay, especially at nighttime. So then you cut down that frequency of having
Yeah.
to get up and then having to get back to sleep.
Yeah. It's
Right?
a lot. It's a lot.
Yeah, it is.
Well, I,
So
I think that's amazing. That's a really good tip. It's, we've covered today, sisters, like everything from, again, why this is happening, why it's getting harder, why, how we can get help, how to know which area it is. And yeah, like recognizing those irritants, recognizing the fact that there is a mental load to this that we can actually focus on and work through. And it almost seems like that stepping stone is learn more, test yourself with where you're at, remove the irritants, really work on those mental blocks and do the exercises, just like anything,
yeah,
but that it can drastically improve, if not heal.
eliminate. Yeah,
Yeah.
yeah,
Eliminate.
yeah.
Amazing. Leslie, so I think we talked about bit already, but the best way for anyone who wants to set up a call with you or just learn more from you, the best way is through where we talked about
We Thrive Wellness
We Thrive
Center
Wellness.
in
Okay.
Belleville. Yeah, Belleville, Ontario. If you go on the website, you can connect to booking in either a 15-minute phone consult if you wanted to chat a little bit.
Yeah.
And then there's access to booking any other services there.
Amazing. And they have an Instagram as well. So, and there's virtual, like it's a virtual appointment. So you can just go and learn a little bit more, but don't suffer. This is our way, sisters, for being more in your life and not just less on a scale. Thank you so much, Leslie.
Thank you for having me.
All right, everyone. We'll catch you on the next episode.